Hello there, and thank you for joining me for the 2018 AHI PPS DSRIP Compliance Training. I'm your presenter, Alicia Sirk, Corporate Compliance and Privacy Security Specialist here at AHI. What is DSRIP? DSRIP stands for Delivery System Reform Incentive Payment Program. DSRIP's purpose is to fundamentally restructure the healthcare delivery system by reinvesting in the Medicaid program with the primary goal of reducing avoidable hospital use by 25% over 5 years. DSRIP aims to restructure the healthcare delivery system through incentivizing and investing in provider collaborations, also known as Performing Provider Systems, or PPS. Up to $6.42 billion are allocated to this program, with payouts based upon achieving predefined results in system transformation, clinical management, and population health, in accordance with the certain terms and conditions that were imposed by CMS. Each PPS is required to commit to work on at least 5, but no more than 11 projects defined under the DSRIP program. Each PPS must work with its partners to identify which partners will work on which projects. AHI PPS is involved in 11 projects. Who are the players? So the PPS are the entities that are responsible for creating and implementing a DSRIP project, and they're called the Performing Provider Systems, or PPS. Performing Provider Systems are providers that form a network based on contractual relationships and collaborate on DSRIP project plan. The PPS lead is a safety net provider that serves as the convener of the Performing Provider System, and the PPS lead is responsible for overseeing the administration and operation of the PPS in accordance with PPS governance structure, serving as a recipient of funds from New York State, distributing funds to PPS partners in accordance with participation agreements and agreed upon funds flow plans. AHI is that PPS lead. PPS partner. The partner is a provider or other entity that has entered into a participation agreement with the PPS lead to perform certain services and collaborate with a PPS in connection with DSRIP program and or one or more DSRIP projects. The PPS compliance officer is a PPS lead employee who has been given responsibility for the day-to-day operation of PPS's compliance program. PPS Regional Compliance Work Group. That's a work group made up of compliance professionals from AHI. There's one of us, and that would be me. And partner organizations, there are 16 involved. New York State Office of Medicaid Inspector General, or OMEG, is the lead New York State agency responsible for improving and preserving the integrity of the New York State Medicaid program by conducting and coordinating fraud, waste, and abuse control activities for all state agencies responsible for services funded by Medicaid. OMEG is empowered to conduct compliance reviews and audits of Medicaid providers, including PPS partners and leads. DSRIP Independent Assessor. The Independent Assessor is a DOH vendor responsible for ongoing monitoring of performance and reporting deliverables. And then contractors and vendors. There are individuals or companies that are not PPS partners, but that are engaged in the PPS by the PPS lead or by a PPS partner to perform services on their behalf in furtherance of the DSRIP program. The contractors and vendors are still under your purview, but they may not be necessarily a partner. Statewide Health Information Network of New York, or the SHINY, is a network of networks or information superhighway through which health information can be exchanged between and among providers regionally or throughout New York State, including for DSRIP purposes. RIOs, or Regional Health Information Exchanges, are organizations that facilitate health information exchange through the SHINY among participating providers within a geographic region of New York State. We use HCME in our region. And then qualified entities, or QEs, are RIOs that have been certified by New York State as meeting certain specific and specified criteria. So the DSRIP overview. All DSRIP funds will be based on performance and linked to achievement of project milestones. In order for your practice or agency to receive these special funds, you are required to collaborate to implement innovative projects focusing on the system transformation, clinical improvement, and population health improvement. In order for your practice or agency to receive DSRIP funds and or receive data, you are required to complete all AHI PPS compliance requirements. That includes the annual assessment questionnaires, training, and attestations. What is corporate compliance? It establishes a culture that promotes integrity and ethical behavior. It provides assistance in complying with complex governmental regulations, including those related to fraud, false claims, theft or embezzlement, kickbacks, or other violations. It identifies issues of concern and detects and prevents patterns of improper conduct, and it safeguards public and private funds, so it helps control fraud, waste, and abuse. Why do we need a compliance program? It is important that we track the DSRIP dollars to ensure that the money is not connected with fraudulent behavior or practices. DSRIP Corporate Compliance Program applicability. So the DSRIP Corporate Compliance Program applies to all affected individuals according to the guidelines laid out by OMIG. And affected individuals entail all members of your board of trustees or board of directors, all members of your executive, so any executive members of your staff. They're all required to complete DSRIP compliance training. Now, any medical staff, employees, volunteers, students and interns, vendors, agents, or independent contractors that are involved in any aspect in any DSRIP project that you are involved in, they are required to complete compliance training as well. Some organizations train all of their staff because it's just easier with regard to moving people between job duties, or if they do change jobs and they don't have to train them later. Others choose to do it on a case-by-case basis and only train those who are already directly involved in those aspects of DSRIP projects. That will be up to you. Just please make sure that you have fully documented this in all of your paperwork, including in your training binders that will be reviewed next year as well, or possibly in the meantime, after you've submitted your compliance training. General New York State compliance requirements for Medicaid providers, including PPS leads. So New York State Social Services Law, Section 363D, and 18 of the New York Codes of Rules and Regulations, Part 521, requires certain providers to annually certify through the OMIG website that they have an effective compliance program. It is required of providers that are subject to Public Health Law A28 or 36, or the Mental Hygiene Law, Article 16 and Article 31. And it's also required of providers that claim, order, bill, or receive more than $500,000 in any 12 months from Medicaid. New York State requires compliance programs to cover the following areas: billing and payments, so claimed performance payments under DSRIP, quality of care and medical necessity determinations, governance, mandatory reporting, credentialing process, and other risk areas identified. So privacy, conflicts, antitrust are just some examples of that. Now, it's important to note that not all PPS partners are required to have their own compliance program under New York State law, but all must comply with the requirements of their PPS's compliance programs. Some PPS partners that were not previously required to have compliance programs under New York State law may become required to do so by virtue of receipt of DSRIP payments that result in their meeting the $500,000 threshold. All partners must receive compliance training as per master participation agreements and assigned by AHI Compliance Department. So note that while you may not normally be required to have a compliance program, if you do not have one, AHI will give you one. And that was with the 2017 General and DSRIP Compliance Training. And so you're required to stay up to date with that as well. But if you do have one, you were only required in 2017 to complete the DSRIP compliance training. And again, that's an annual training for your in-house folks as well. If you have any questions, please reach out to me to decipher your concerns. Roles and responsibilities in the DSRIP compliance. PPS leads are required to design a compliance program for the PPS consistent with New York State requirements that focuses on the compliance risks and concerns within the DSRIP program, including policies and procedures that describe PPS compliance expectations, disciplinary policies, non-intimidation, non-retaliation policies, process for reporting compliance issues to the PPS compliance officer or department, process for risk identification, including auditing, monitoring PPS partners' DSRIP performance, system for responding to compliance issues, and then training and education of all affected employees or individuals and certain others. The PPS partners are required to participate in good faith in meeting the applicable metrics of the DSRIP program, implement training and education provided by the PPS lead, develop or maintain a compliance program where required under New York State law, observe contractual and other compliance requirements as required by the PPS lead and state law, regulation, and policy. And then if you suspect that quality indicators are being falsely reported to satisfy DSRIP requirements, you must report it. If you suspect that a provider is falsifying documentation on their Medicaid patient, you are also required to report that. And you would report that to AHI compliance. PPS leads are not responsible for PPS partners' non-DSRIP compliance programs or activities, but please note, again, as indicated earlier, if you do not have a general compliance program, we will give you one, and if you do, we're not going to monitor your activities that have nothing to do with DSRIP. And you can see Article 2 and Article 8 of the AHI Master Participation Agreement. PPS compliance policies and procedures. So PPS leads must have policies and procedures specifically relating to DSRIP issues, and that's for element 1. AHI PPS's compliance policies and procedures can be found at the link indicated right below this. And so ahi-PPS/AHI-PPS/policies-procedures/. Policies can also be viewed and attested to for your organization by your compliance contact through the NAVIX Global platform. And that is our policy platform called PolicyTech. And again, it's just specifically for the compliance contact to attest and view for your overall organizations. Those policies can also be downloaded from that location and saved to train the staff. Any questions about the policies and procedures should be directed to AHI PPS Compliance Department. The Code of Conduct Conflict of Interest Policy. So it boils down to some of these things. Compliance is everyone's business. If you see something, say something. There is zero tolerance for retaliation for good faith reporting. Safeguard DSRIP funds and DSRIP data. Ensure proper credentials and licensures. Conflicts of interest. If you have them, declare them, mitigate them, and avoid them. Provide accurate and truthful information. Take an active role in compliance education. Help to ensure medically necessary and quality care. No exclusions from government health care programs are allowed. So if you are excluded from any government program, you are not allowed to participate in the DSRIP process and receive funds for that. Protect patient confidentiality, other business information, and if you are unsure about any of these things, please ask us. Whistleblower policy. The lead must have a policy of non-intimidation and non-retaliation and support PPS partners' compliance with this requirement. That's under element 8. So roles and responsibilities for this is PPS leads are responsible for ensuring non-intimidation and non-retaliation with respect to their own staff. PPS partners must comply with this requirement with respect to their staff. PPS leads should support the implementation of this element by their PPS partners, and each PPS must have a process for sanctioning or terminating participation in the PPS in the event of a PPS partner's non-compliance with PPS policies, procedures, or contractual requirements. And you can see Article 8 of the AHI Master Participation Agreement for this. So employee whistleblower protections are under 41 U.S.C. 4712, and employers are prohibited from discharging, demoting, or otherwise discriminating against an employee as a reprisal for disclosing to any of the government entities or any entity that is within the purview of auditing and monitoring information that the employee reasonably believes is evidence of gross mismanagement of a federal contract, a gross waste of federal funds, an abuse of authority related to federal contract, a substantial and specific danger to public health or safety, or a violation of law, rule, or regulation related to a federal contract, including the competition for or negotiation of a contract. Reprisal is prohibited even if it is undertaken at the request of an executive branch official, unless the request takes the form of a non-discretionary directive and is within the authority of the executive branch official making the request. Please note that New York State has a similar policy, and so it applies to any government-funded project with regard to the healthcare system as well. So DSRIP is fully involved in that, is under that purview. An employee who believes that he or she has been discharged, demoted, or otherwise discriminated against contrary to this policy may submit a complaint with the Inspector General of the agency concerned. Procedures for submitting fraud, waste, and abuse and whistleblower complaints are generally accessible on agencies, Office of Inspector General hotlines, or whistleblower internet sites. And you can see Article 8 of the AHI Master Participation Agreement for this. So reporting DSRIP compliance concerns. PPS lead must have an established process of reporting compliance issues to the compliance officer, including by an anonymous confidential method, and that's element 4. If you suspect a breach of fraud, waste, or abuse of DSRIP funds, report it to the AHI Compliance Department. You can do it in one of many different ways. There's an anonymous compliance hotline, so externally from AHI, you call 844-386-2242, and you can leave a message. That message will be de-identified from the number calling in. It will be attached to an email and sent to the AHI compliance team at ahihealth.org. We will hear your voice. Feel free to disguise it if you'd like, but please make sure when you're reporting in an anonymous fashion, you leave as much information as possible. Even the small details can be important, so please leave all of the information. You can reach out to the Chief Operating and Compliance Officer, Jeff Hiscox, at 518-480-0111, extension 109, or jhiscox at ahihealth.org, or you can email the AHI compliance team at ahihealth.org. You may also contact me directly, Alicia Sirk, at 518-480-0111, extension 110, or asirk, S-I-R-K, at ahihealth.org, or again at the AHI compliance team at ahihealth.org. We also have an online reporting form. You can either complete it online or you can mail it in, and it's located in the footer. If you go to the footer of the AHI website, you click on the link on the bottom for corporate compliance, and then it'll take you to the site, to the form, to either print it, fill it out, print it, and mail it, or fill it out and it will automatically email to the AHI compliance team at ahihealth.org. All reports are confidential and they may be anonymous, and it is illegal for anyone to retaliate against an employee who reports suspected fraud, waste, or abuse. So when you're at the bottom of the AHI website, when you click on that, and actually this link down here at the very bottom will get you to the form as well. It'll get you to this page, AHI Corporate Compliance Customer Service Reporting. So for the compliance, you're going to click on the AHI Corporate Compliance Reporting form if you want to get the form. You can call the hotline. The hotline is listed there as well. And when you do that, you'll get the form and complete it and attach it. Either the email will be sent or you can print it out and mail it in. We also have a third-party reporting system through something called Ethics Point. So, AHI's goal is to ensure that you have multiple venues to report any compliance concerns that you have. So we have set up this third-party reporting platform that will provide additional comfort for reporting concerns, both confidentially and anonymously. In order to utilize this method, you can either call this 844 number, so 4252, and you'll speak with a representative from this third-party affiliate who will help you to complete your report, or you can click on this Ethics Point link to be redirected to the third-party site where you can complete the report form electronically. So if you suspect a breach of privacy, confidentiality, or fraud, waste, or abuse, report it to the AHI compliance. In situations where you prefer to place an anonymous report in confidence, you are encouraged to use this hotline that's hosted by the third party. Ethics Point, you are encouraged to submit reports relating to violations stated in our Code of Conduct, as well as asking for guidance related to policies and procedures and providing positive suggestions and stories. The information you provide will be sent to us by Ethics Point on a totally confidential and anonymous basis, should you choose. You have our guarantee that your comments will be heard. So again, you can call the 844 number, so it's 844-251-4252, and speak with a representative who will help you complete your report. Or you can click on the Ethics Point reporting hotline, or reporting online, and this domain right here will take you right to it as well, and you can complete that form yourself and submit. Please report concerns about fraud, waste, abuse, safety, privacy, and security. It is a policy of AHI PPS to encourage prompt reporting at the earliest reasonable opportunity by employees, board members, clients, independent contractors, and vendors of any activity or conduct in violation of any AHI PPS compliance policy or any federal, state, or local laws or regulations pertaining to compliance-related matters. So some examples include, but are not limited to, Medicare, Medicaid fraud and abuse, falsification of medical records, harassment or discrimination, health, safety, and environmental issues, questionable billing or coding activities, HIPAA privacy or security violations, any good faith concerns, and any form of retaliation against those reporting a potential violation in good faith. Again, you can call the AHI compliance hotline, or you can call the third-party hotline, or you can email AHI compliance team at ahihealth.org, again, or the link at the footer of the AHI website, however you feel is necessary and most accommodating. All calls received on the hotline are confidential, and messages may be left anonymously. Individuals leaving an anonymous message once again are encouraged to provide as many details as possible in order for AHI to conduct a proper investigation. Individuals reporting problems or concerns of good faith will be protected from retaliation, retribution, or harassment. So it's important to understand under Element 4 what the difference between confidential and anonymous is. Anonymous means that you do not provide your name. If you choose anonymous reporting, be sure to provide enough details that we can investigate. Confidential means that you provide your name, but request that we do not disclose your identity as the reporter. We will do our best to shield your identity, but cannot guarantee it will never be known. For example, we could be compelled to share it by an external agency, investigation, or court order. Reporting fraud, waste, and abuse of district funds. Workforce members who are aware of any violations of the Code of Conduct, false claims, or any other inaccurate practices are expected to report their concerns to the AHI Compliance Department. Anyone who makes a good faith report to their immediate supervisor or the AHI Compliance Department of a potential corporate compliance violation is specifically protected from retaliation. Again, reports can be made in person, by email, by online report, by postal mail, or phone call. And if you do submit a written report, you're going to mail that to AHI Compliance Department, 101 Ridge Street, Glens Falls, New York, 12801. The confidentiality of the person making the report will be protected to the fullest extent possible. AHI prohibits retaliation or threats of reprisal against any person who reports a possible compliance violation. If retaliation occurs, it should be reported immediately to AHI's Compliance Department, CEO, or Board of Directors. AHI expects that all PPS partners will comply with the compliance plan, including the requirements of monitoring, auditing, self-disclosure, and in reporting and assisting in the resolution of all compliance issues involving DSRIP funds. AHI PPS suspecting fraud, partners suspecting fraud, waste, or abuse of DSRIP funds is expected to report compliance issues at the earliest possible opportunity to AHI's compliance department by any method outlined in this plan. Failure to comply with any aspect of the compliance plan will result in disciplinary action, up to and including termination of contract with AHI in accordance with general AHI disciplinary policies. And anyone who makes a good faith report to AHI's compliance department of potential corporate compliance violation is specifically protected from retaliation. I know some of these things seem like they're repeats. They kind of are, because it's important to understand these and remember these. In an effort to assure that all potential compliance issues are reported, AHI requires all PPS partners to have an anti-intimidation and anti-retaliation policy in place to protect any workforce member of its organization who makes a good faith report to AHI. It's also important to understand the differences between fraud, waste, and abuse. So, waste is overutilization of services or other practices that directly or indirectly result in unnecessary costs to the Medicare and Medicaid program. Waste is generally not considered to be caused by criminally negligent actions, but rather the misuse of resources. Abuse includes actions that may directly or indirectly result in unnecessary costs to the Medicaid or Medicare program, and it involves payment for items or services when there is not legal entitlement to that payment, and the provider has not knowingly or intentionally misrepresented facts to obtain the payment. One of the primary differences between fraud, waste, and abuse is intent and knowledge. Fraud requires the person to have an intent to obtain payment and the knowledge that their actions are wrong. Waste and abuse may involve obtaining an improper payment, but does not require the same intent and knowledge. I will place one caveat to that. I have seen cases prosecuted for fraud based on the fact that the individuals knew or should have known. So if they should have known that their actions were wrong, then they can still be prosecuted under the fraud requirements. So roadmap for compliance reporting. I'm going to share this with you. If it's a DSRIP-related situation, it will follow both paths. If it is solely AHI related, it will just follow the path to the left. So let's say it's just AHI related. The compliance report will come in. AHI compliance will investigate it, have a disposition, send it to the AHI compliance and audit committee, and that will go up to the board of directors. If it is DSRIP related, it will follow that path, but it will also follow this path to the right. So after AHI has investigated and completed their disposition, it will be reported up to the DSRIP compliance work group. There they will make any other suggestions or possible sanctions. It'll go to the finance committee, DSRIP steering, and then of course to the board of directors. Laws and regulations related to fraud, waste, and abuse. These are in the original training. I'm just going to give you the titles and the location to look up the statute, or you can refer back to the 2017 training as well, because they're all there and they apply to us under the DSRIP project. What is PHI? So these are patient identifiers. There are 18 of these that make up what the patient identifiers are. Depending on how this information is treated, used, stored, or held or disclosed, it could be PHI. So if you are unsure, please make sure you contact your compliance department and or AHI PPS. At all times, you should try to make sure that it's your priority to protect any one of these patient identifiers. So through the process of going through risk assessments and such, we have determined that cyber terrorism is one of the elements that is a risk area for each and every one of us, and it's growing every day. So we wanted to do a little bit of training to touch base on this. So here's some best practices or reminders for staff. So always check for confidential content. So before forwarding or replying to emails, check any attachments in the body of the email for sensitive data. Scroll all the way down to the bottom of the email and check for confidential contacts, so PHI, PII, or a combination of both, including but not limited to social security numbers, PINs, credit card data, etc. Links and attachments. Do not click on links or open attachments from unknown senders. If you receive an email from a known sender that looks out of the ordinary, do not open the attachment or click on the link. Beware of social engineering tactics. So customize personal message text, Dear John, or please review the attached invoice for. So just be aware of these things. They are targeting people, and just because it's customized does not necessarily mean it is safe. Spoof or forge the sender name so it appears to be from someone you know. Make the message, they make the message threatening, so your account will be closed unless you. So there's a sense of urgency often in these emails. They make the message look official. So if you look at this support at Microsoft.com, if you're hovering over this, it may not necessarily go to that link. If it goes somewhere else, they've just created a situation where it looks like that and not necessarily where it's going. And so they also make the attachment look harmless. So my vacation pictures. So just be aware of these items of social engineering tactics. Manually encrypt. So when sending sensitive data to authorized individuals outside of AHI or outside of your organization, manually encrypt the email. Keep a clean machine. So make sure to store sensitive data on your secure drive and not on a local drive. So your C drive is not secure, but every organization should have some sort of secure drive set up for the particular information. Firewall security protections. Never manually override any of your computer's firewall or security protections. And avoid clicking if you see a pop-up like this. Attention, your PC is infected with spyware. It's a warning. They want you to click on this OK to get a list of available anti-spyware products. Do not click on it. Avoid clicking on any of these buttons. Do not click on OK. Do not click on cancel or anything else that pops up. Instead, close the window by pressing Control L, not Control L, Control and F4 on your keyboard. So when you push the Control button and F4 at the same time, it will manually close that box. And then make sure you do report that to your IT department or compliance as well. Guard company data when you're on the go. So treat all public Wi-Fi networks as a security risk. Choose the most secure option. It could include password protection or encryption, even if you have to pay for it. Confirm the exact spelling of the wireless network you're connecting to. Beware of clever, slightly misspelled fakes, such as if you look at this, it says Micra and there's no O, soft.com. So your eye, when it first glances at that, might not pick up that. So just be diligent in looking at links and addresses. Encrypt all confidential data on smartphones, laptops, flash drives, and other portable devices in case they are lost or stolen. Never make financial or other sensitive transactions on any device over public wireless networks. And whenever possible, connect to a VPN. Use flash drives carefully. Minimize the chance that you'll infect your company network with malware. So be sure to follow your organization's media policy on that. Every organization is different. Don't put any unknown flash drive or USB drive into your computer. USB drives handed out at expos are one example. There was a scenario where there was an individual that looked like they were from a reputable company, and they were handing out flash drives at a big expo. They were all infected with malware, and when people popped them into their computers, they were then attacked. Whenever possible, use encrypted flash drives, and don't open any unfamiliar files on your flash drive. Some more best practices: verify. Trust but verify. Hover. Before clicking on any link or a linkable item, so like a photo, a PDF, or an image, hover over it with your mouse. So you're going to take your mouse and you're just going to go over it like this. And you're hovering over that to reveal the address. Make sure it's a legitimate address. And if it appears to be suspicious, do not click. Compare. Compare a web address and a link with the actual address that is associated with the legitimate site. Look for changed letters or other variations. Caution. If something seems suspicious or too good to be true, always err on the side of caution. Links. Never use links in an email to connect to a site unless you are absolutely sure they are authentic. It is safer to type the URL address directly into the browser itself. That way you can ensure that it's going where you want it to go and not necessarily where the link is sending it. Sharing online. Be careful what you share online. Personal information you share online could be used to target you in an attempt called spear phishing. Embedded forms. Never submit confidential information on forms embedded within email messages. Social networking. Do not assume social networking sites are safe. There were just 50 million people hacked the other day on Facebook with another 90 million potentials by virtue of their connections. So pictures, videos, invitations to games, applications, menus, and navigational elements can all be infected with malware. Even these things on reputable sites can still be infected with malware. So please just be careful with where you're clicking, even for your personal stuff. Report. Immediately report suspicious network activity and suspected phishing attacks that are likely to trick your coworkers to your compliance and/or IT departments, and AHI compliance when necessary. Continuous onboarding and annual training. So please remember that as rolled out with the 2017 DSRIP compliance training and with the 2017 general and DSRIP compliance training, that your organization is required to use the training that you were assigned as continuous annual training, as well as an onboarding and new hire training. You will be attesting to this completion on the attestation for this 2018 DSRIP compliance training. So just make sure you're reviewing that your folks are up to date, and any new hires or onboards are also trained in that as well, because it goes into depth into other areas that this training is not covering. Additional materials provided. So these are the policies that are being provided, and they are both located on the Policy Tech website that the compliance individual will have access to, and they can print them out, download them, and disperse them, or they can also download them from the AHI PPS policies-procedures part of the ahihealth.org website. And so each of those must be reviewed by every individual taking the training and attested to. There's also, for your convenience, a sign-in sheet located there, just so that you have it and you can keep track of all those individuals who completed this training. The Policy Tech portal is for use by the organization's compliance individual. So each partner organization will have one person who is able to access the policy management system. This person will be the organization's responsible compliance contact. You will receive a welcome letter if you haven't already, with instructions on how to log in. You will use this account to download, print, and disseminate policies for review by all those affected individuals to be trained at your organization. You will also use the system to attest to policies and the training for your organization. Please be sure to not only mark policies as read, but also to complete any attached questionnaires or forms for each policy indicated. Policies that require a questionnaire and is not completed, but is marked as read, are considered incomplete. You should be able to use the system to return any documents electronically that we will be requiring for DSRIP compliance training. If you have any questions or issues, please reach out to me, Alicia Cirque at AHI, acirc at ahihealth.org, or 518-480-0111, extension 110. Here's the Policy Tech portal welcome letter that you should have received. It looks something like this. If you still have that, you can still go in and click on this link to log in to get into the system, and then it will require you to set up a password. If you do not, you can go in, through the portal, and this email, you will receive an email with instructions to do that, on how to put in your your website, your email address, and get instructions on how to set your password at that point. That's all I have for the 2018 training. If you have any questions, once again, please reach out to me by either phone or email. And I hope that you enjoyed this training and that it was helpful. And I look forward to hearing from many of you and to receiving these training materials back, the attestations. Once again, thank you and have a great day. Bye-bye.